Thank you for joining me on Working It Out with Darius. Today's episode has been pre-recorded. For more episodes of Working It Out with Darius, go to our YouTube channel at City Love Speaks. Enjoy the show. Hello, everyone. Thank you so much for joining me with Working Out with Darius. This is episode 6, our recap episode. I'm very, very excited to have this episode where we can talk about all the episodes previous to this. We're going to pick up certain points, and we have joining with us today Dr. Kyle Schultz, who's going to discuss aspects of the show as well. Let's see. Bring you on.
Hello. Hi, Darius. Good to see you.
It's good to see you too. How are you?
I'm doing well, thanks. Thank you for having me on this.
Oh, yeah. Thank you so much for coming on. So, Working It Out with Darius. Something that in iterations you and I have kind of talked about as well. This is something that came from having conversations with my close friends about topics and things like that kind of don't really get discussed in depth. Like, I think that we kind of talk about mental health sometimes, or we talk about self-care. You know, a lot of people talk about self-care, like having a self-care Sunday or having a day in which they get their nails done or get their hair done or go to the spa. And really, I wanted to delve into what people are really practicing for their self-care. And one of the things that last episode, Dr. Gilbert talked about was really going to those uncomfortable places. And she took self-care and said, okay, I'm going to sit with myself and work on those hard things. Mm-hmm. And that's what she considered self-care versus self-maintenance being, let me go get my hair done, let me go get my nails done, get a massage, those things that kind of just have an upkeep for our mental health.
Yeah.
Can you speak on that a little bit for me?
Yeah, sure. And when I think about the idea of self-care versus self-maintenance, I do also like the idea of thinking of self-maintenance as what are the things that I need to do to meet kind of a bare minimum for the day to keep functioning, to keep the house running, the apartment running, to keep your life running to some degree. So when I think of self-maintenance, I think of the things that people have to do, that we all have to do to keep going. Mm-hmm. Self-care, I see as very similar to that, but I also see the way in which self-care is kind of related a bit more as well to growth, and the things that one needs to grow oneself. I think that self-care over the last 5 to 10 years, probably less, has taken on kind of an in vogue cliche word that people love to use. Mm-hmm. They love to talk about their self-care as binging, watching Netflix all day, or doing something that might be vaguely unhealthy or unproductive. And that's not to say that one behavior is or is not self-care. It's just the way in which we engage it. And so typically when I talk to folks about the idea of self-care, I really try and highlight, like, how is this actually helping you to take care of yourself? Yeah, I don't know. That's how I think about it.
Yeah, it's great that you talked about the growth part, like self-care being things that actually help you to grow and develop versus self-maintenance being just kind of like upkeep of where you already are.
Yeah.
And because I know for me, you know, having freshly gotten a haircut, like that helps me to maintain like where I am.
Yeah.
But it's the deeper dives that I take in the conversations through therapy, exploration, that conversations that I have with friends, you know, with you when you're like, okay, here's your homework, you need to go and listen to this podcast. Mm-hmm. Like, and me actually going in and searching for things, for these anecdotes, for these resources that are going to actually help develop my growth, mentally, spiritually, physically, however that is.
Yeah.
And I think that's definitely one thing that we kind of confuse it in the whole mix of things. What were you going to say? I'm sorry.
Well, no, I was really appreciating, you said the person that you had on last episode, I can't remember their name, but I think that it was that's a really great way of thinking about it, because that is a form of trying to work on oneself and grow by pushing into the more difficult aspects of our psychological experience, our emotional experience, our thoughts and stuff like that. And in the work that I do with clients and with students, I am often talking about the idea of self-reflection and the idea that one very much should be taking an honest, genuine look at oneself, and preferably a non-critical one. I think that when people think about self-reflection, they sometimes think that it means evaluating all the things that you're doing wrong and what needs to change, and kind of a very deficits mindset, rather than what are the things that I'm good at, or what's going well, or how am I being really successful in my life. And in terms of pushing into some of that stuff, I think that certainly pushing into the areas that need to be grown is important, but also pushing into and accepting, like, I've done this pretty well today. I'm pretty happy with myself. Yeah,
I think one thing that's coming up for me, that as we talk about self-care, right? So it's those things that we do to actually develop ourselves and grow, asking the hard questions and doing some digger deeping. What's coming up for me now is like, and what I want to kind of convey to the audience is, what are the things that are barriers for me doing self-care? And one of the things for me is avoidance.
Yeah.
Can you talk a little bit about avoidance? Because I kind of want to get on going that, but I want to introduce this topic of avoidance.
Yeah, sure. I guess the way that I think about it, avoidance, procrastination are very similar to each other. And it's the idea that I'm going to put off something that's kind of important for a sort of short-term gain of not facing it. And so whether it's talking about with students or with patients of mine, what are the things that you're avoiding because you don't want to deal with it? And that's sort of a short-term response to feel good, which is totally understandable. Not saying it's a bad thing.
Right.
Avoidance becomes a bad thing when we avoid something over time, and it ends up really tripping us up or causing a problem down the road. And so in the psychotherapy world, one of the things we talk about are approach versus avoidance strategies. And thinking about the way in which some of the things that are going on in someone's life that are difficult, like how often are you approaching them and how often are you avoiding them? And not to be too mechanical about it, but if you're spending all of your time avoiding the things in your life that are important, that's a problem. I also, like I said, I want to be clear too that I think sometimes there's an overvaluing of approach, as if it's just really easy to approach the things in our life that are difficult, which is not the case. And so, to the other point that that your friend made last episode, the idea of pushing into those things is actually difficult. It takes some time. It takes mental fortitude. It takes us being in a place that we want to do that and are willing to put up with whatever comes up when we do that.
Yeah, absolutely. This is a perfect time to kind of move into the next topic, because oftentimes for me, when I know that I'm avoiding something, somehow I feel like the universe has a way of bringing it up and presenting it. And one of the things that has happened on the show that kind of happened organically is that we begin to develop these themes and these forms of therapy. So like earlier in the show, Veronica came on. She's Brown Skin Plant Mama on.
Yeah, I saw that one, yeah.
And she talked about plant therapy. And so when I think about avoidance, but then I think about all these alternative forms of therapy, can we talk about how engaging in things like plant therapy can actually bring up these things and make them more approachable?
Yeah. I think I sort of struggle with calling things like plant therapy or book therapy, as if these things have to be therapy to be productive or useful or growth oriented. If people want to call them that, that's fine. But I do think that things like that you've had on the show, plant therapy, comedy, music, like these things are all important things related to our mental health that doesn't require one to have access to a therapist. It's one of the things that I really tried to convey to students, to people, that yes, I'm a psychologist. Yes, I do therapy in a moderately sized practice. I teach on this stuff, but I also recognize that it's not going to be the thing that's going to help everyone to grow or to take care of themselves. And I, of course, am biased in thinking that that is an important thing. And I always say that not everyone needs therapy, but everyone can benefit from it. But something like plants or music or arts are things that are therapeutic, that help people's mental health, that have nothing to do necessarily with therapy. And pushing people to recognize, because first of all, access to therapy is a privilege. It's a financial privilege that if one has the insurance and or the money to pay for it and access to good clinicians, that's a privilege to take advantage of if possible, but not everyone has that stuff.
Yeah, that is definitely true. And which is one of the reasons I was so glad to have the guests on, because they really found ways in which they took their, what I call inner resources, those things that they are given or blessed with or whatnot, and they begin to cultivate it in a way that allows them to be in a space of vulnerability. Because I think that that's the important, anytime that we're thinking about therapy in any sense, whether you're doing it with a therapist or whether you're doing some therapeutic things on your own, it's really like, how can I get into a space of vulnerability with myself?
I think that that's a fantastic point. And what, like, to go off of that a little bit, when I think of the idea of intimacy, well, I don't think of it just as a sexual intimacy, but as an emotional vulnerability, an emotional risk-taking, to put oneself out there, to be seen, to be engaged with. And of course, that happens in good therapy. That's one of the major points of it, is to make oneself vulnerable to the process and to start to look at things that are difficult for them. But I think that that vulnerability, that intimacy, that trust can happen in relationships as well. Now, I'll be very careful in sort of pointing out that I'm not saying that your friend should be your therapist. That's not at all what I'm saying. But I would say that in even using our friendship as an example, through the years that we've known each other, we've had really, I would argue, intimate conversations that are not, I would say, are not therapy, but I think have been helpful, at least for me, if not for you. And so thinking about ways in which having intimate, vulnerable, open relationships with other people, while scary, I think is a really important aspect of mental health.
Yeah, absolutely. And that now, of course, there's so many things running through my head that I'm going to try to capture onto one of these thoughts, because we've kind of opened up a can of worms. Because I think that as I'm thinking about kind of how our conversation is going, we're talking about, there's therapy, which you can engage with a therapist, someone who is trained to kind of, and the way that I look at my therapist is an objective view of the patterns in my life. So like going through therapy with my most recent therapist, I've been with her for 4 years. And it wasn't until year 1.5 to 2 that she was able to say, okay, every August to October, we're running into the same issues. We're running into, whether it be around your father, whether it be around your, you know what I'm saying? So really that's that objective eye to kind of say, and it then trains me to also have that objective eye. So that when I'm engaging in things like plant therapy and I begin to become vulnerable and things begin to come up for me, I can use the same training that I got working with my therapist to then begin to process through my issues on my own. And for me, that's the greatest benefit of having a therapist and then having other mechanisms in my life in which creates that space of vulnerability for me.
It's one of the things that I hear most from my own patients and even from the students that I supervise, that one of the things that people find most helpful is quite literally what you said, is you're an objective person, you don't know me, you're not, and I also think people are sort of saying you're not influenced by me in a way that you would feel uncomfortable sharing something with me that might make me uncomfortable. So what I mean by that is, I think people are used to people in their lives sugarcoating things and not going there with them. And again, I'm not saying that that's the easiest thing to do or that everyone should just go full steam into that. But to have an objective observer point something out to you, particularly something that might be difficult, you're less likely going to take it personally because you know that this person doesn't know you. They're not in your life. They only know you in the context of therapy and with the presumption that they're trying to help you grow, which it's a lot more complicated, I think, for personal relationships.
It is.
And I do want to add and interject too. And again, I know this is an economic issue, but one of the things that you said too that I think is important is that I think therapy should be a longer term thing. I think it should be at least a year, if not more. And again, I recognize that there's economics to that, but the current in vogue nature of mental health treatment is very mental illness oriented, and is often oriented to short-term treatment, like 3 to 6 months. I'm not saying that nothing can be done substantially in 3 to 6 months, but in my own experience, both as a therapist and a patient, that stuff just comes out in a different way and after the first year. Like, and I've heard some folks will say the first year of therapy is really just getting to know each other. Which might blow people's mind because it's a long time, but I like to bring up to people, well, if you really look at how many hours maybe you've known your best friend versus how many hours you've known your therapist, like, it's a different number, and you're much more likely to share something with your best friend because you have all of this time that you've spent with them.
Exactly. And it brings up something that we kind of touched on previously in one of the first episodes when I was with Damian. We talked about, having how people engage their mental wellness. Excuse me. And going to therapy about a specific situation is kind of like a 3 month to 6 months. Okay, let's talk about, you're having anxiety. What do you think is bringing it up? Okay, it's your job. So that's what you kind of focus on for that time to figure out, okay, how can we begin to regulate this so that you're not having so much anxiety around this?
Yeah.
Versus when you're in it long term, it's really, let's look at your life and how different things appear and show up. So it's not around one specific situation. It's really around how you collectively look at your life and how you begin to process the things that you're engaging with and that are happening to you.
Yeah. And that holistic way of taking everything in, to me, practically and logically, is just going to take some time to get used to. And so when I think about shorter term approaches that are often much more focused on symptoms and developing tools, I don't think that those things are necessarily a bad thing. But they do end up, I think, being very focused and specific. You there?
Yeah, technical difficulties. Everything just died. I mean, I apologize.
You want to keep talking? Or you want to wait?
Absolutely, absolutely. So I lost you when you were about to go into your next point. So I'm sorry about that. Go ahead.
Oh man, what was I just about to say? What was I just saying?
Because I was talking specifically about therapy around a specific situation. Yeah. So I'm sorry. Can you pick it there?
And I actually literally just spoke with someone about this very issue. Like, people do come into therapy because they often have a very specific thing they want to deal with. And that's not weird. That's typically how people come in. And a lot of work can happen on that thing, particularly in a relatively short amount of time if you are being focused. But in my experience being a therapist and even being in therapy, that after you work on a very specific issue, there's a moment where you're like, ooh, I could just get out of here and I don't have to look at anything else going on in my life. Knowing full well that there are other things that once the main issue is dealt with, you're like, ooh, like, do I want to deal with this, or do I want to like get out real quick and people come to therapy because they want to get one issue dealt with and out of the way, and they don't want to stay. Again, that's fine. But if we're working in a very holistic way, just because one issue is dealt with and quote unquote solved doesn't mean that there are not other things that need to be dealt with.
Oh, absolutely. And I've always taken the stance with therapy is that this person is like a personal trainer. It's really training your mental toughness, your mental endurance, and your mental stamina. Because I remember when I first started doing therapy, it was rough, just even getting in there and getting through the first 50 minutes. And then after time, it was like 50 minutes would fly by like this. And then I started doing, it's not. And then I started doing all this work outside of my therapy. And then I started doing all this reading and things outside of my therapy that then introduced me into other ways of like, oh, I crochet. That is a perfect form of meditation. During my meditation, what comes up for me when I do that? Or when I'm listening to music. When I'm listening to certain songs and I begin to become vulnerable, how is it that I can use that moment to then grow and develop? And so that's really the tools that I've been equipped with that I try to use. Go ahead.
And one of the things I think that that you're saying that I think is important is and typically the way that I think about what happens for clients when they work with me is not just that they get whatever issue they brought in worked on or solved or processed or whatever words you want to use. But over the course of our work, there's some models of therapy that talk about the ways in which clients internalize the therapy process itself. And so as all of us meet with our therapists and talk with them, we get we know what they're going to ask, whether we're aware of it or not. We know where they're going to go. We know what they're likely going to say. And so the internalization of the therapist or the therapy process is something that we can and should take out of therapy. And so, you know, when you're talking about sitting down and crocheting, I imagine that some of the self-reflection or self-therapy, if you want to call it that, is you kind of applying that process that you learned with your therapist to be reflective of what's going on in your mind and what you might be struggling with in that moment, or not even struggling with, just what's on your mind.
Absolutely. So as we're talking about therapists and in-person therapy, what advice could you give, what advice could you give if someone is trying to find a good therapist? Like, what questions can they ask? Like, in that process, how can they begin to engage that search pattern process?
Sure. And this, to me, I think is actually really complicated and really does affect access to mental health services, because I don't think that it's easy to find a therapist. It's actually quite a process. And I think people, in terms of finding a good therapist, first of all, I think the way that you should work, if you can, is talking with folks who've had positive therapy experiences. To me, it's connecting people with someone who they feel like they could have a good connection with or something went well with. The problem is most people don't necessarily have those resources, or might not necessarily want the therapist that their friend has or their partner has or what have you. But Psychology Today honestly becomes a really good resource. PsychologyToday.com is a way in which people can search the area that they live. They can search the price that they want to be able to pay. They can search the type of insurance. They can search the problem. They can research specific aspects of the therapist's identity. So I identify as a cisgender gay man, and so I'll identify that myself that way on that site. So people who are looking for that can look for that. So people can also search for sexual orientation, gender identity, race, I think religion as well, ethnicity, stuff like that. And so going there allows you to get a whole overview of people who might be good for you. And one of the things I have to tell folks, and I even tell my own patients this as well, is that you should meet with at least 2 or 3 therapists if possible. And like I said, I say that to my own patients even because I think that, and not I think, I know that most of the therapy research supports the idea that therapy and counseling is way more productive when you have a good relationship with the therapist. And what I typically describe that as, who does it click with? If you meet with 2 to 3 therapists and you think about those 3, who does it feel like it clicks with a little bit more? Who do you feel like gets you a little bit more? And I encourage people to pay attention to, when you're meeting with someone, what doesn't feel right and why, and to rely on that.
Right.
I think that we all have to know what we want to some degree from a therapist if there's specific. So again, I typically work with queer men, and so a good amount of them want a queer male therapist. So meeting with someone, and I was just having this conversation with someone a month ago. You don't have to meet with someone first. You can send as many questions as you want to your therapist or the person you're going to meet with before they meet. I was speaking with a friend of mine who was looking for therapy referrals, and I said, you know, you can ask because we had settled on someone who seemed like they might be a good fit, but I didn't know whether or not they were a queer person. And I said, you know, you can ask him. He's like, oh, I didn't realize, I thought that might be inappropriate. And no, it's not inappropriate. And so I think that it's okay to really reflect on, like, what do I want, and can this person give it to me? I hate thinking about therapy as a product or a commodity to be consumed, but you are a consumer, and so you should make informed decisions about where you're spending and investing your money.
Right. Yep. So the other thing is this. So as you were talking about asking therapist questions, it came up for me. Like, I literally had a conversation with a friend of mine who I was trying to get in therapy. He was like, you know, this, that, and the other, blah, blah, blah. And I was like, you need to treat it like you treat these apps, bruh. So you need to Ask them what they're into, right? Because we had this conversation because I was specifically talking to you about the fact that I am now at a crossroad because I know what I need from counseling and therapy right now. And a lot of it is for my therapist to have the awareness around race. Remember we had this conversation? You said that might be, he's like, your psychiatrist has to also, I forgot how you put it, it was so clinical, has to also factor in your trauma around race as something that they consider to be a factor in my, I forget how you worded it. It was so clinical and it pissed me off. So just go ahead and say that again.
What I was probably saying is that I think particularly with race, obviously more recently coming up with everything that's been happening this summer, like it's okay to ask your therapist about what their thoughts and feelings are about some of the recent racial issues in this country. You want a therapist, if that's important to you, you want a therapist then who is knowledgeable of that and can talk about that kind of thing, and who appreciates the effect that race, and like I said, to use examples from my own practice, not just race, but also sexual orientation. Like if you don't have a therapist who can appreciate those aspects of culture and how it might relate to your identity, I do think that that's going to be an issue, because then you run into people stereotyping or pathologizing, and kind of making the process harder, worse, potentially damaging, honestly.
Right. And also, like, because I know that now we've started hearing a lot more talk around like generational trauma being passed on through DNA. Is that something that is a newer type of concept that maybe all psychiatrists or therapists may not be into?
Well, it really depends, because one of the things, and if I go too deep into the weeds, just let me know. Like, again, the major predominant approach is called cognitive behavioral therapy, and it is often a very short-term, symptom-focused. I'm going to teach you tools and teach you about your depression or your trauma or your PTSD or your generalized anxiety. And you'll often hear, and this is not across the board, because you'll have certain CBT, cognitive behavioral therapists, who kind of break the mold a little bit. But one of the things I will often share with my own patients is, like, I talk about things from the past. I think that those things very much do influence someone's present. When you talk with most CBT clinicians, you'll find that they very much are looking at the present. I just recently started working with someone who had worked with another clinician for over a year, and the clinician and others that they had previously really focused them on the present day, which they're like, it wasn't unhelpful and I benefited from it. But the one thing that they said to me was, like, I really just want to work on root causes. I want to be able to look back into my life and process things that I haven't processed before. And so one of the things that I'll tell patients kind of from the beginning, that's my approach. To me, it's a part of informed consent, that if you're going to be working with me, I'm going to let you know how I tend to work, how I tend to. Thing that folks who are watching and listening might want to do is ask their therapist, like, do you focus only on the present? Do you only focus on the past or the future? Because focusing on the past exclusively as well is also a problem. Like, you need to be able to be flexible enough to talk about, and to me, it's about client responsiveness. Like, how do I be responsive to what it is this client needs? I've had people come in that they just want to work on what's in front of them. Okay. And I'll usually tell them I'm fine doing that. I'm likely also going to ask you some background questions, and that's how I think about it. So I very much encourage people to be informed consumers and to know that therapists are trained to answer these questions in the beginning. And if your therapist won't answer the question, you don't want to go to them. Like, you want someone who can answer the questions that you have. Are you threatened by that? Or they sort of roll that into, well, this is part of your problem or some pathology. You don't want that.
Right. It goes back to when I was talking to my friend, like, ask them what they're into. If that matches up to what you're looking for, then meet up, you know, and have a conversation, but never as a client or as a patient or feel like that the therapist is totally in control. And I think that's one of the things that I want to definitely empower everybody is, like, as the patient, as the client, you're more in control of how this whole process is going to work out. Can you speak on that?
Yeah, definitely. And in terms of counselors that people might see, you'll see very directive counselors, and you'll see very non-directive counselors that, in a way, you kind of want to pay attention to who's in charge here. Like, am I able, when I go into my session, to talk about what I want to talk about and
Right.
determine my agenda and really sort of prioritize where I want my therapy to go? Or is it really going to be about you as the therapist telling me what I'm supposed to do?
Right.
Not my favorite. I recognize that in my role that I'm the quote unquote professional or the expert, but at least in terms of this person's life, they know more about themselves than I do. And so when I think of good therapy relationships, I think of something that is very collaborative, that the professional you're working with trusts and understands that you're the expert on your own life, and that you're going to inherently know where you want to go. And my role in working with clients is often say, well, this is something I've sort of seen and it might be an issue. What do you think about that? And sometimes it'll be like, I don't really want to focus on that. That's not really something that I'm interested in. And sometimes they'll say something to the effect of like, it's been something that's been on my mind for a while. I just haven't really got into it because it's been really difficult. But now that I'm here, it might be something that I want to look into a little bit further on.
Absolutely, man. Thank you so much. I would love to have you back again for a recap.
Definitely.
For sure.
So I'm happy to
go. And I think that overall in this conversation, what would be beneficial is working with you. And I want to post this on our City Love Speak site, is like, when you're looking for a question, what are the appropriate questions to ask?
Yeah.
So I think that's, so if we can work together on like, hey, just a real quick looking for a therapist one-on-one, these are that you should ask. These are the ways that you should feel comfortable approaching your therapist. And if you meet any resistance around these questions, then that's a red flag that this probably isn't the person for you.
Yeah, I agree.
Awesome. I'm so glad to be working together.
Yes.
So thank you so much, Kyle. Like I said, we're definitely going to bring you back in. And you have a great rest of your day.
Thank you. Thank you for having me on.
Absolutely. Thank you. Man, that was Dr. Kyle Schultz. I am so grateful for him as a friend in my life. And so now we're going to bring back on my brother, Damian Michael, who came in the first episode with us. His backstage just smiling and cheesing.
Hello. Great to be back.
Yes. Now, I've been doing a lot of talking, so I'm going to go ahead and just pass you the floor. And after all, because you were backstage and you heard that. So,
oh my God,
we're definitely
so much information.
So we are definitely going to recap each of the episodes.
Okay.
But just go ahead and just kind of give me a recap on what stood out and resonated with you during my conversation with Kyle.
What really stood out to me out of all the great information that he gave was having at least 3 to 4 different psychologists, and I was like, wow. I said, I never thought of that. But it's just like a shoe. It has to be a perfect fit. And I was like, that makes total sense. And to make sure it fits along with your life. And how, who would you benefit more with? So that it's still like resounding in my head, like, wow, I never thought of that. So to know that you can just, spread yourself around a little bit, do a little shopping per se.
Okay.
Like, okay, you're nice, but you come a little short here, so no, and then you go to the next, so yeah.
And what complicates that process is this, because I talked about, engaging it in the way that we do the apps, like, what are you into? What is it that I'm looking for? Blah, blah, blah. But the truth of the matter is there's a time factor. Like, sometimes it takes a long time to even get in with a therapist. And I'm going to cover this as well. So there really is, and hearing him say, like, you ask them questions ahead of time, like email them questions. And I'm going to work with Kyle about what would be some really good questions to ask to kind of get an idea of what the therapist's philosophy is.
Yes, that would be greatly insightful.
What happens is your appointment is a month away.
Right.
You haven't communicated with this person. You show up cold and there's no spark.
Right. Cold turkey.
You have to go through the months of finding another therapist and then where you additional another month. So like doing all this groundwork ahead of time is going to be so much beneficial, and asking these questions ahead of time would be beneficial. So yeah.
Most definitely.
Man, thank you so much for coming on this journey with me.
No problem at all. I'm enjoying it. I'm enjoying it. I mean, this is every show thus far has been phenomenal. It seems like it get better and better. You know how you watch your favorite series, and each show has something even more. And I'm like, wow, this is exactly how it's been. It's been amazing and very helpful because trust me, I've been getting my life on your show.
Right. And speaking of life, Veronica brought that aspect in with plant therapy.
Yes.
And what I really appreciated about Veronica is, and especially plant therapy in this time, is actually literally putting your hands and putting life into something else. And literally like your breath is what, I'm saying, is what plants thrive on. Like all those things.
Right.
And to be able to give that out to something is amazing, because one of the things that I did was on Anxiety Healers, they posted on Instagram to buy a plant, name it after you, so that when you speak to it and you water it, you're doing those same things to yourself.
Right.
So that was one takeaway I took from it. What tell me about what you thought about Veronica and the.
First of all, she's amazing. Second of all, didn't know I could do that much or get that much from plants. And actually, I do have a green thumb. Go figure. But yeah, who knew? But really, what I got out of what Veronica was talking about and what she was sharing with us was that the rotation of life and energy, positive energy, what you give to the plant and what you allow the plant to get back to you, as well as to others, can produce into something beautiful. And I was like, wow, this is really real. And it all makes sense. Not just common, but also spiritual sense. So I really, took a lot away from that, but that was the main, bullet point that I took away from that.
Absolutely, man, absolutely. So in breathing life and talking about plant therapy, one of the things that I'm so grateful for Kyle for is just really pointing out that, there are other ways in which we can engage ourselves.
Yes.
Laughter, and if anybody that knows me, I laugh loudly, like very loud. and we let it. There's a video. I wish I had that video. I wish I had thought about scooping it up, but it's about when you see your other friend or you laugh at how people laugh, and it's us running through the streets, falling on the floor, rolling. But it really is therapeutic in the way that even just the way it engages your body and your physiology.
Right.
The way it engages your core and all that great stuff. So for me, comedy theory is important. And one of the things I appreciate about that both Andre and Andrew were talking about was how they use it to cope with their own discomfort with things that are going on right now.
True.
So that was my takeaway from it. What were your thoughts around comedy therapy and just comedy therapy in general, and laughter and how that kind of brings you a space of vulnerability?
First of all, laughter is not only contagious, but it's also healing. It heals wounds if you allow it to, if you open yourself up to it. And, what I took away from that, because one of the things as I deal with daily my chronic depression, but I've realized that I still have the ability to choose joy. I could find something, even on a dark day. If I find something on my Apple TV or wherever that makes me laugh, that lightens the load. Even if it doesn't leave, it makes it, I'm able to, it enables me to carry it for however long I need. So comedy is just healing, and Andre was amazing. He's a showstopper. He just is. He's a showstopper. So I love it.
And the three of us have hung out.
Yeah.
And so yeah.
So we know.
Yeah.
We know how we get down. Yes.
I want to share something that I was having a conversation with a close friend of mine about, because one of the things that both Andre and Andrew brought up was talks about making comedy of things that are uncomfortable for them and that also make other people uncomfortable. So one of the things for me is Joe, I'll use this example. I was talking to a close friend of mine, and we were talking about plant therapy, and they were talking about show. He's like, yeah. He was like, I didn't realize, she brought up a bunch of good points, and I was like, yeah. He's like, yeah, I didn't realize, that I could have a green thumb. He's like, because I thought I just kill everything, and I was like, well, you're still here, so that's a testament that you can't kill everything. And so we laughed about it because he had, issues around suicide. But the thing about it is, in that moment, we had this moment of laughter, and it wasn't, we're not laughing at suicide, we're not laughing at, but it was just almost a moment of joy where we realized, like, yeah, I haven't killed everything that I've touched.
Right.
But someone else outside might hear that and think, well, that's really dark comedy. But we're really like, no, because there is healing in my hands, and there is that in my hands too. And so, but that plant therapy and that comedy therapy together, it was just amazing in that moment. I'm getting chills right now thinking about it, because there's a level of vulnerability when you can talk about that. Can you speak to that too?
One of the things that I have for the last 3 to 4 years, vulnerability has become a true reality to me. But first of all, after fighting it, and I finally stopped, because you won't win. Because especially as you grow in wisdom and in knowledge and in life, you'll understand certain points that you thought were strong, you really weren't. It was just a cover-up. So vulnerability invokes or invites healing. It invites an open mind. And even that moment with your friend, that was a peak and a moment of healing. As you said, that was a key word of healing, and life happened right there. And it comes in a millisecond. But you have to not only be vulnerable, but you have to, which includes you or causes you, if you're allowed to be, to avail yourself to whatever that moment brings. So when you do that, then everything that you've been thinking about, meditating about, praying for, can come into fruition. But you have to avail yourself to that vulnerability, that moment.
Absolutely. Whew, man. I'm going to take a breath.
Hey.
You know how I get when I get excited?
Right.
Start talking fast.
All is well.
I love connecting with you, and I love these moments, because when we talk about healing, healing is an acceleration of your cells and of that energy, because it begins to repair.
True.
And when I think about that repairing itself and the movement, of the energy throughout your body, and that just brings us right into music and dance. Because for me, a lot of healing and a lot of movement from one place to another is really literally me physically moving my body.
Right.
And I was reading.
It's a freedom.
Yes. So for me, dance is a huge part, because I was reading on anxiety healers. Again, I'm going to put the idea at some point, but they posted that when you have anxiety, your brain goes into fight or flight. So it is a physical response to what's going on. And so, like, when your heart is pounding and all that kind of stuff. So they said, go for a jog or go for a walk, because it convinces your mind that you're in flight mode. And so it gives that excess energy the ability to transfer, so that then you can go back after about 10, 15 minutes and really think about where it is that you're really sitting, because now you've given that anxiety its space. You've honored it. You've honored this energy. You've given it space, and now you can move forward. And dance does that for me.
Yes.
Dance does that for me. What? Talk to me about you, dance, music, how those things really.
Brother, as you know, music is like my second nature. I mean, I adore music. Music has the power to say those things that words cannot. I love it, because especially when certain kinds of music or a certain artist has that type of flow that frees me, even if I do decide to take a walk. But that's one of my getaway times, is going outside in nature, in the neighborhood or wherever, put on a comfortable shoe and put on my headphones and listen to some great music. And even while I'm walking, I can feel it. Sometimes I have to stop and groove a little bit, because it hits me. So where that comes in with music and it becoming therapy is when you allow it to take control, give into it. Because just like you said, that anxiety is like, oh God, what are we going to do? What's going to give into it? Just breathe and give into it. And it's healing in that. And that's your therapy right there.
And that brings up such a great point, especially when we're dealing with anxiety in particular, because it is such a physical response in our body.
Right.
And I want to be very clear, when we're saying give into it, we're not talking about giving into all of the thoughts that are racing through your minds. It's really like allowing the energy to flow through you. And for me, music and dance is a way that I can safely allow that energy its space, because I'm also in the groove. You know what I'm saying?
Right.
I'm moving, I'm doing this. And so that is a very safe and vulnerable space to be, and allow your thoughts to be, and just allow yourself to be without any judgment.
Let it consume you.
Yeah, just I'm telling you, and I've done that. I go on walks and I just let the music take me, and I allow that anxiety, that anxious energy that then just turns into motion, and then I'm jogging or I'm dancing. Those are really, really good ways that I found to cope, man.
Right. Yes. I totally agree. I totally agree.
Whew.
Yeah.
Again, I'm very, very grateful for you on this journey. And so you're going to be joining us regularly.
Yeah.
Yeah. And I'm very, very excited about that, because one of the things.
Totally geek.
Oh, sorry. I apologize. Backstage. I'm going to keep my. This is what I get when I start touching stuff when I get anxious. So, yeah, because one of the things that you brought to the show was your insight on gratitude. And what I appreciate about you, Damian, is anytime that I talk to you, no matter where you are in your status, you know what I'm saying? And you are always very real with me. And that's why one time we can always talk, because I'll be like, how are you doing? You're like, not well.
Yeah.
Not well at all.
But truth will set you free.
Then you go into, I hear the way you talk though. You know, your gratitude is in your voice. It is in your existence.
Yes.
Because I think that you're at a place where you realize, I'm not well, but I am here. I'm not going to speak for you. You need to go ahead and say that now, because.
Just like this morning, I woke up and after that breath I took, all I could say was, thank you, God. Gratitude to me is such a wide space, especially with dealing with all that I've dealt with and all I'm dealing with now. My gratitude is knowing that with all of the extremities going on and the chaos that's going on the outside as well as the inside, there is a strength, there's a power within me that allows me to choose joy, even in the midst of my own personal war. So I find gratitude in that. I find gratitude in knowing that when I walk into a room, everyone knows that I'm a king. It's not anything to show off, but it's a natural reality. My crown is with me every day. So knowing that, confidence, big dude and all.
Yeah.
No matter what I add to myself, no matter what I take away, I'm fearfully and wonderfully created. And there is nothing that can deny my royalty, nor my presence, my positive presence, me being here and present in the moment. And being thankful just for that. Even if everything in my life is failing, or I don't know, I can't even see, it's so thick in my own reality to where I can't even see where to take the next step. But just to know that I'm still here. I'm present and in the moment, and I'm going to be thankful and grateful. So gratitude goes a long way. I could go on and on about gratitude, because knowing all the things that the transitions that I've had to make that have cost me a lot,
Mm-hmm.
But yet, the mere fact that I was obedient to where I needed to go.
Mm-hmm.
Because a lot of things that we want to desire, even those things that we need,
Mm-hmm.
those calls on our lives, they cost you. They come with a cost. But in the end, you have to stay focused that not only is it going to be worth it, but even in the moment, I am worth it. I'm worth this struggle. I'm worth this process. And I do have everyday gratefulness, knowing that every step that I make, every sentence that I write, every positive word and energy that I give is a step forward into my destiny and my purpose.
Man, I am so excited about having you on this journey. My heart is full. It is so full.
Humble. Thank you.
And I mean that pretty much is going to wrap up the show. Damian's going to be with us with Everyday Gratefulness going forward, and then at the end of the month, he's going to be joining. We're going to recap every end of the month.
Yes.
And along with having a therapist as well. Thank you so much, Damian. Thank you to all the viewers. Wow, I'm sorry. Just give me a moment. I'm really full.
Hey, we're gonna lose our money.
I'm really full. I'm really full.
Yeah.
This has been amazing. And just so that we're sure that everybody understands that we're serious about the things that we do.
Extremely serious.
Yeah, I have resources here that we're gonna post for you. Hold on, let me get to that slide. There we go. That you all can tap into. Yes, let it go. I'm sorry. I'm trying to drive y'all backstage, and it doesn't work that well. I need to start allowing things to flow. So, but thank you so much, everyone, all the viewers, our guests, Damian, Kyle, backstage, everyone. Thank you so much for tuning into Working Out with Darius. We're going to continue on next month. We're going to start talking about relationships with ourselves, relationships with our friends and family, and then intimate relationships as well, and romantic relationships. So join us next month. We're going to start it up. On tomorrow night, we're going to have City Love Speaks, 8 p.m. Eastern Standard Time, 5 p.m. Pacific Time. And again, we're going to have our panel of hosts there. It's going to be wonderful. Every Tuesday we do that. Then again, Working Out with Darius on Monday as well. Whew. Taking a breather, y'all, because y'all know how full I get. Thank you so much again, everyone. And we will see you once again. Thanks for tuning in.